Okay, sir.
ARDS can develop anytime. Okay. All right. For this, in our previous classes, I always mention you have to understand the concept. Okay, you have to understand the concept for almost everything. So I will try to go through all of the things, and I will try to break all the concepts. Okay, so here from the part A, I want to ask Dr. Manur again.
Yes,
So if there is a ascending cholangitis, okay,
yes.
what are the clinical features you will be having?
So it
Three,
would be
mainly
pain.
three.
Yes, pain in the right hypochondrium,
Mhm.
fever, and fever
Yes.
with rigors and chills, and jaundice.
Fantastic. Jaundice, yes. And this is known as?
The Charcot's triad.
Fantastic. If I ask you, what is Raynaud's pentad? Do you know that?
Yes, sir. In addition to
Fantastic.
that, it also
Yes, plus?
it has altered state of consciousness and
Altered level of consciousness. And this is known as Raynaud's pentad. Okay. The five things in Raynaud's and Charcot's, there are three things. Excellent. Excellent. Fantastic. Okay. Now we will be discussing about the concepts of the pancreatitis itself. Can anyone tell me what is the pancreatitis exactly? What is pancreatitis? What is pancreatitis?
So it is autodigestion of the pancreatic parenchyma and surrounding fat due to premature activation of trypsinogen, which causes the digestion of the proteins and also saponification.
Excellent. Excellent. Fantastic. Okay. So you have to know the basic concept of the pancreas. Okay. First of all, these are the ducts, right? These are the pancreatic duct. And also with the duct, we have two things. One is the endocrine function of the pancreas. Also, we have the exocrine function, right? From the endocrine function, what are the things we have? We have something like alpha cells, beta cells, right? So you are expecting to have insulin, something like glucagon, okay? All of those things from the endocrine part. Also, we have the exocrine, right? From the exocrine part, we are expecting to have what?
The trypsinogen.
Yes.
Like
so as a whole,
lipase.
yes, as a whole, you can say enzymes, right?
Enzymes.
The pancreatic enzymes. Okay. So in a collective way, we can say these are zymogens. Okay. These are called zymogens. Okay. In the zymogens, there are different types of pancreatic enzymes. Mainly, zymogens are known as you said, the trypsinogen. Okay. The trypsins. Yeah. All right. What else? What are the other things? Okay, I will just show you something here, then that will be easier. Okay, so here, this is your pancreatic duct. Okay, and also these are your ducts, and there are some acinic cells. There are some acinic cells, right? Like this. Okay, this is your duct. Accessory ducts, okay, and these are your acinic cells. Okay, so from the acinic cells, if you can think like this is your acinic cell, okay, and you have your nucleus. Within the nucleus, you have some DNA, and when this is stimulated, okay, the DNA will produce some specific proteins, and this specific protein will go into the endoplasmic reticulum, and from the ribosome, it will take up, and it will ultimately produce some specific proteins, and there is a Golgi apparatus. From the Golgi apparatus, it will produce a vesicle. Okay, within the vesicle, you can think there are 4 types of enzymes that will be produced. 4 types of enzymes. Okay, from this is the basic. Okay, what are the 4 types of enzyme we talked about? First thing, this is amylase. Amylase is responsible for what?
Protein digestion.
Sorry?
Yes.
Amylase is for
Carbohydrates.
carbohydrates.
Carbohydrate digestion.
Carbohydrate, okay? So it will break down the carbohydrate and make the complex carbohydrate in the simpler form of glucose, right? So that's why we have the amylase in our salivary gland as well. In salivary secretion, we have the amylase as well, right? And that amylase is known as S-amylase because it's from saliva. And this amylase is known as P-amylase because it is from the pancreas. Okay, so just try to remember all of these things because you will understand why I'm saying all of these things. Okay, next thing, you will be having a lipase as well. Lipase, right? What is the function of the lipase? It will break down the
Lipids.
Fat.
the fats. Okay, fourth thing is the fourth one is any other enzyme? Tell me. Any other enzyme?
Trypsinogen.
Yes,
Protease.
the zymogens, as I said, zymogen, the trypsinogen. Okay, as you can see, trypsinogens. Okay, and we have the fourth one as well. The fourth one is
Enterokinase.
no, enterokinase is from the duodenum itself,
Oh,
intestine itself.
Yes.
Okay.
Sorry.
All right, this is known as protease
Mhm.
inhibitor.
Yes.
Inhibitor. Okay, protease inhibitor. Why we need the protease inhibitor? Because there are some protease enzyme as well. Okay, and that can cause the destruction. Yes, destruction of these vacuoles. Okay, this granule. This is a granule. This contains all the 4 enzymes. The protease can break down this, and if these granules is broken down, that means the trypsins, the lipase, the amylase, everything will be open, right? Everything will be there. So it can cause the autodigestion of the pancreas itself. So that's why we need this protease inhibitor. Till now, is it clear? Till now, is it clear? Okay, now we have something here as well. These are the epithelium, ductal epithelium, right? And the ductal epithelium are responsible for developing of what? Anyone? Bicarbonate rich fluids. Okay, bicarbonate rich fluids from the ductal epithelium. Okay, till now, is it clear for all of you?
Yes.
All right, so now I will talk about something. As we know about the cause of the acute pancreatitis. All of you, if I ask you what are the cause of acute pancreatitis, you will say I get smashed, right? I get smashed. What does it mean by I get smashed? So I is for idiopathic, G for gallstone, E for ethanol, T for trauma, S for steroids, M for infection. You can say it's a MAMS. Okay, so all of those things you know, but you have to know the basics and how these will cause acute pancreatitis. Anyone can tell me how the alcohol can cause acute pancreatitis? Anyone has any idea? Anyone?
It causes injury to the cells and also causes premature relaxation of the sphincter of Horty, contraction of the penis.
No. Okay. Here, the thing is, in case of alcohol, it will do something here. As you can see, these are the ductal epithelium, right? ductal epithelium. So the alcohol will cause the stimulation over this ductal epithelium. Okay, if these ductal epitheliums got stimulated, then there will be what? Bicarbonate rich fluid will be stimulated, right? So if there is bicarbonate rich fluids is there, that means the secretion will be thick. Okay, so if the excellent, yes. So if the secretion is got thicker, that means there is a chance of obstruction of these ducts. If there is an obstruction, that means there will be accumulation of these enzymes. Yes. So if there is an accumulation of these enzymes, that means it will be, yes, there will be sometimes these protease inhibitors will be lost, and also there are something called the lysosomes. Okay, lysosomes. And there is a flow, right? There is a normal flow of these granules to go and pass through these ducts to go into the duodenum, right? So now if it is blocked, these hormones, these enzymes cannot go and pass, and that means it is getting clogged here, right? Here. And then these lysosomes will be activated, and it will cause two things. One is the protease inhibitor will be lost. Okay, there is a negative effect. That means the granules will be ruptured and all the enzymes will be out. And this lipase and then this zymogen will ultimately cause the autodigestion of the pancreas itself, and then it can lead to formation of pancreatitis. Is it clear how the alcohol can cause? That's the first thing you have to know. Is it clear till now?
Yes.
Okay, so we have two things to understand. One thing, obstruction and stimulation of these acidic cells. There is a problem in the acidic cells, or there is a problem in the flow. All of the things, all of the eye gets smashed will ultimately cause these two things. Is the basic is clear? How then the gallstones will cause acute pancreatitis. See? Excellent, fantastic, excellent. Who is this? Dr. Kishk? Excellent, excellent, fantastic. So as you can see, the common bile duct is coming, right? The common bile duct is coming, and it is attaching with the main pancreatic duct, and ultimately it will open by forming the ampulla of Vater on the posteromedial aspect of the second part of the duodenum, right? So if there is a stone impacting here, suppose, so that means the ducts are obstructed, and if the duct is obstructed, as I said, it will cause ultimately the same thing, and it can cause acute pancreatitis. Clear till now?
Yes.
Okay. How can the hyperlipidemia how can hyperlipidemia can cause acute pancreatitis? Can anyone, by thinking very deep, this is either duct obstruction or stimulation of these cells? Who can tell me? This is very easy.
Hyperlipidemia would aid in formation of cholesterol gallstones, which can travel up the CVD and block the pancreatic duct.
Without forming the cholesterol gallstones, suppose there is no gallstone.
It can form
only
there is ischemic damage to cells.
Excellent, fantastic, Manur. How?
So because it will cause chronic ischemia due to capillary circulation impediment.
Fantastic. So if I can think, so think like this: there is high amount of lipids, right? And these lipids will cause ultimately the formation of atherosclerosis. Okay, maybe. Okay, atherosclerosis. So if there is a tiny capillaries in the pancreas, okay, these capillaries will get clogged. these capillaries will get clogged, right? And that means if there is a clogged of the capillaries, ultimately there will be ischemia, right? There will be ischemia. If there is a ischemia, that means there is a necrosis of the pancreatic tissues itself. Get that? How hyperlipidemia can cause this?
Yes.
All right. Next, can anyone tell me about two things? One is hypercalcemia. How the hypercalcemia can cause acute pancreatitis?
So because of premature activation of trypsinogen.
How?
Increased trypsinogen formation.
How?
Because trypsinogen conversion requires calcium, so increased levels cause. I'm not sure, but I think maybe
No.
this is
Yes. Tell me more.
So all I know is maybe because calcium is required for conversion of trypsinogen to trypsin. So if there is an increased level, so it like causes it to form at an increased rate. Maybe I'm not sure about it.
Yes, you are
Maybe
right.
calcium deposition. Deposition is lipid.
Deposition of calcium in
Yeah.
pancreatic
Deposition?
duct.
Yes, there is a deposition.
Destruction of the cells.
Yes. Okay. And how the acute pancreatitis can cause hypocalcemia?
Saponification of the
Because of
calcium is
saponification.
Fantastic. The saponification. How? In acute pancreatitis, as I said, there will be destruction of these granules. So there is release of this lipase, right? This lipase. So if there are some fat tissues as well in the pancreas, so there will be fat digestion. Okay, so that means if there is a fat digestion, there are free fatty acids. Okay, there are free fatty acids. So these free fatty acids will be taken up, these calciums. Okay, this calcium will be taken up by these free fatty acids. So if the free fatty acids, fatty acids, they're taken up this calcium, that means overall in the blood there will be hypocalcemia. Clear?
Reduced iodized calcium, so there will be hypocalcemia.
Okay, clear?
Yes, sir.
Till now?
Yes, sir.
Are you guys with me?
The hypercalcemia,
Yes, sir.
what is the cause
Yes,
of
sir.
pancreatitis due to hypercalcemia?
Yes.
Can you please
The
explain once more?
normally, in some enzymes, it needs to have the calcium to be converted. Okay, and also here, if there is a increased amount of calcium, it will stimulate these cells. Also, the main problem is the protease inhibitors. The main problem is in protease inhibitor. The calcium will have a negative effect over the protease inhibitor. That means the protease inhibitor cannot act properly. Okay, so if there is less amount of protease inhibitor, that means the protease enzyme can cause the lysis of these granules. And if the same thing, if there is a lysis of these granules, that means all these enzymes can go and it is open and cause the autodigestion of the pancreas itself, simply.
Right. Okay, sir.
Okay, so these are few things you have to understand. Okay, next, let's talk about the complications. Okay, so if I ask now, what are the causes of acute pancreatitis, how they can cause acute pancreatitis, is it clear for all of you?
Yes.
Less clear or very clear?
Very clear, sir.
Fantastic. Okay, next you have to think about the complications. Okay, so the complications of acute pancreatitis are so many complications. Okay, but you have to think few of the complications. So the first thing first, always remember infection. Okay, infection. That means there is some inflammation, right? In inflammation, there is some pain. Okay, so think there are some inflammation. Okay, and there are some pain. Where should be the pain? Where should be the pain? In the epigastric region. So the patient will have the epigastric pain. Okay, the epigastric pain. Okay, the patient cannot lie in supine position, but or if the patient lie in supine position, the patient's pain get worse. Why?
Irritation of the diaphragm.
Irritation of?
Irritation of the britone.
Yes, the thing is, when you
is detrimental structure, no. So
Sir.
if the patient lies, can I?
Leaning forward,
The thing is, when you are lying, that
Yeah.
means you
All
are
that
stretching. You are stretching the anterior abdominal wall.
Yeah.
Okay, so you are stretching the anterior abdominal wall. So if this anterior abdominal wall gets stressed, that means it is getting some pressure over this pancreas, and the pain gets worse. And that's why some patient will lean forward. Okay, and leaning forward will relieve the pain, and the position of leaning forward is known as
Mohammedan position.
fantastic, excellent. And now you know why leaning forward relieve the pain. Okay, next is the patient can have jaundice. How?
So what do we call the leaning forward
Mohammedan
position?
position.
Okay.
Mohammedan
edema
position.
of the pancreas.
How you can have
Edema.
jaundice?
Edema of pancreas will cause pressure on the CBD.
Excellent. Yes.
Yeah.
So in acute pancreatitis, as I said, it's about inflammation. So if there is inflammation in the pancreatic duct, that means it will obstruct the CBD. And if there is an obstruction of the CBD, that means we are expecting to have obstructive jaundice in patient. Clear? Next, think something like this. The patient can develop ileus. How? How?
Due to pain and vagal irritation.
Yes.
Okay, so think something like this. You have the stomach here. See. There is some. This is your stomach, right? So there are inflammation over here. There, all of this area are inflamed, right? They are inflamed. So if there is a inflammation, that means there is obstruction of the gastric outlet. Okay, maybe gastric outlet or in the duodenum itself, because of the compression effect. Okay, because of the compression effect. So if there is compression, if there is an obstruction in the foods, in the food pipes, okay, so what does it mean? There will be less amount of motility. So the food cannot pass in a normal pace. That means it can lead to formation of ileus. Clear?
Any inflammatory process inside the abdomen can cause ileus. I think
Yes.
because
Yes.
of the sequestrated fluid from the pancreas.